Hi guys, welcome to my 36-week pregnancy vlog. Today is Monday and technically I'm 37 weeks full term. Yay, I'm very excited about that. I am due April 1st, so I got about 3 weeks left to go. Although this is not about 37 weeks, so we'll backtrack a little bit. This is about my 36th week, which was quite a week. Symptom-wise, I definitely had some new symptoms and have some not some questions, but I have a question or kind of a plea for advice, and I'll talk about that kind of towards the end here. I'll talk about my doctor's appointment as well that I have now that I'm going on a weekly basis, and my progress, or lack thereof maybe. Well, this week started off with some pretty basic symptoms, some ongoing ones that I've been having for the past couple of weeks, if not more. Some like back pain, not like necessarily my upper, but like right between my shoulder blades. I guess that would be upper back pain. Just when I'm laying down, mostly it's like pressure, and then lower back pain when I'm walking, that sciatica nerve pain, which isn't too intolerable. It's more of just a, a minor annoyance, I guess. I've been having headaches, and that is kind of new. I did have headaches, I think, early on in my second trimester. But I really haven't had too many since then. I was a little concerned because I know that that's a sign of preeclampsia, but I didn't really have any other symptoms to be too concerned about that would be associated with that, which is a lot of swelling, also blurred vision, faintness, faintness. I'm sorry, I can't think straight. Super exhausted today. Yeah, so I wasn't too concerned also because the last few appointments my blood pressure has been fairly normal, so I kind of knew that if it wasn't too strong and I didn't have other symptoms, not to get too all excited and worried about things. I have besides the headaches, I have had some kind of fun, I guess, for lack of a better word, symptoms. I've been having some cramping, mostly like period type cramping, which I actually have had past maybe a couple of weeks lightly, but it's becoming more intense and more like frequent, but not like contraction exactly, cramps, just kind of like that achy feeling sometimes you get before your period, which sucks. It's not like a fun feeling, but it's exciting because it does mean that, my body's preparing for Labor Day. Also, I've been having some irregular contractions, and those are similar to that kind of like period crampy feeling, but they're definitely more intense and strong, and I can feel starting in my back, and it does wrap around, and my stomach does get tight, but nothing regular. I knew that I was not in labor. It's just, some contractions here and there, at least what I think are contractions. It hasn't been verified on like a monitor or anything, but they feel like what I would think contractions feel like. So that's kind of exciting to have that, knowing that, maybe my body's just trying to prepare itself for the hopefully soon upcoming big day. So those have been nice. It's kind of been nice to have those contractions. I'm sure I won't be saying that again. But yeah. Other than that, I think I'm going to stop there with my symptoms because that's the main symptoms that I've been having. Actually, I'm sorry. I'm going to backtrack a little bit. There's another thing too that is, I think I had it last week, but I don't think I mentioned it, but it's a newer symptom. I've been having some achiness in between my joints, kind of like where my legs connect with my pelvis, and it's not strong, but it kind of feels like I was like riding a horse, and obviously I haven't been doing that, so I think it's just the pressure because the baby is lower now. It's just more pressure on my pelvis, so I'm pretty sure that's normal, and it's just more of like a nuisance, not a big deal. Yeah, I'm going to stop there. There are a couple more things that I went through symptom-wise, but I'll come back to that. So Thursday, I had my doctor's appointment as usual. I did have, during the day, middle of the day, I had some leakage, and I wasn't sure at first if it was my water or if it was just discharge or what. I mean, I could be like peeing myself. I mean, I heard that can happen. So I did have a little bit more than usual leakage, I guess, or lack of a better word, down there. So I was a little concerned that maybe my water had broken, but I knew that when your water breaks, it's either gonna like gush out or it's gonna continue to, sorry, gotta stop talking with my hands, or it's gonna like trickle ongoing, and it's not just gonna stop, you know, it's gonna keep going, you know, at some point. So I didn't have any more, so I didn't feel like the need to call labor and delivery or anything like that. And also I had my doctor's appointment later that day, so I knew I could ask about it, and obviously if it kept going I was gonna go in. But it didn't. So I went to my appointment, and I was a little bit annoyed because I had to wait so long. I was sitting there like half naked waiting for the doctor for 45 minutes. And I guess it's the price you pay sometimes to see a doctor or a provider that really does take the time to see their patients, and that's something I really do like about my doctor, although there's things that I don't like, but that's one of the things I really do like about her. Is she takes time out of her, you know, normal 15 minutes to actually like talk to you, and she does squeeze people in, so I can be pretty understanding when it comes to that, because I appreciate that she offers that. Not a whole lot of doctors do in my past experience. Anyways, she came in and we did a quick cervical check, and that hurt like the dickens. It really hurt this time. Last time it was like just a little bit of pressure, but this time was like, like want to jump off the table. But I am still closed. However, she did she felt that my cervix is softening, and she couldn't quite tell how thinned out I was because I wasn't dilated, but she did say that I was thinner and the baby's head seemed a little bit lower. So that's definitely progress, and you know what I think you could expect for 36 weeks. Not a whole lot of people are dilated, and if they are, it's to like 1 centimeter, which I don't expect, or I didn't expect, I guess. She did do my fundal height measurement. I was 38.5, so that's kind of nice that I'm not, you know, too big, not too small, kind of like right within that normal range. I told her about the water, and she was kind of like, you know, I could tell, like, labor and delivery. She was like going through her head. I'm like, but it did stop. And she's like, oh, good. But if you're ever in any doubt at all, go down there. And I always feel like, yeah, I know, you want to go down and you want to be cautious and you want to make sure that everything's okay with you and the baby, but I feel like they are so afraid of like lawsuits or things like that. Maybe not lawsuits. I don't know what they're afraid of, but like they just want to send you down for like every little like tiny thing, and I just don't want to be down one of those mothers that are always down there. And I feel like I've been down there 4 times and I haven't even gotten into labor, so I feel kind of silly always going down there. I know it's by my doctor's recommendation, but I know what they are looking for, and I know, you know, what you should be going down to labor and delivery for, which are obviously contractions 3 to 5 minutes apart, at least at my hospital. That's what their requirements are for, you know, active labor, I believe, active labor. You know, if you're having any bleeding, if you're having your water, what you think your water is breaking, and obviously if you're in extreme pain or something like that, those are reasons that they say to go down to labor and delivery. And I kind of feel like she's a little too eager to jump the gun on some things like that. So, yeah, I keep that all into perspective, but I do take things with a grain of salt a little bit, I guess. So that went okay. My doctor's appointment was actually pretty good because I did make a little bit of progress, as much as I can expect to see. However, then on Friday, my sister emailed me at work, and she told me that my niece, my little 4-year-old niece, has Fifth's disease, or slap cheek disease, or something like that. And it's just like mostly common in kids. They get kind of like flu-like symptoms, also like really red rashes around their cheeks, and she had that, and she brought her in to find out what the rash was, and it turns out she had that Fifth's disease, and it's not really dangerous. However, it can be to pregnant women. So of course she emailed me right away like, yeah, I'm sorry, but Lily has Fifth's disease, and it's my niece's name, and you know, they said it couldn't be dangerous to pregnant women. So of course I'm freaking out. I'm like, oh my God, what does this mean? So I kind of I called my doctor. I didn't call them. Did I call them? Yes, I did. I called them and I told them about it. And I left them a message, actually. Okay. So I was waiting for the nurse to call me back, and I ended up Googling it at work. And, you know, mostly what they had said, that it can be a danger to pregnant women, mostly 20 weeks and under. It can cause miscarriage or anemia in the baby. So it's not really dangerous to the pregnant mother, it's more dangerous to the baby or the fetus. But usually it's not a big issue in the 3rd trimester. So I kind of like calmed down, and then they called me back about an hour later from the doctor's office, and they told me that I should come in and get some blood tests done, and if the blood tests show that either I am not immune or I've not had it, I don't have the antibodies. I'm still kind of confused how that works, how the blood, like what they read on the blood test. But basically, if they see any indication that they should be worried, they're going to do an ultrasound at my next appointment this coming Thursday. So I went in right away and got the blood tests, and I have to wait till I think Wednesday to hear back about that. And so I'm a little nervous, but they did explain that the risks, you know, the doctor's office did explain, the nurse who called me back did explain that the risks were very minimal, especially in the 3rd trimester, and even for women that are pregnant 20 weeks and under, it's still pretty minimal risks. So it definitely calmed me down. I'm not too worried about that. So we'll see what the results are on Wednesday or Thursday. I think she said they would come back, and then maybe I'll have an ultrasound on Thursday if necessary. Yeah, so that was kind of a little bit of a freak out, or a little bit of a, you know, a little bit of a scare, I guess, but it's perfectly fine. So this weekend, not this weekend, last night, so technically, I don't know if I was 37 weeks, but I'm including this in the 36 week because, yeah, I still consider it to be 36 weeks. Last night, backtrack, sorry, going out of order, I should have wrote this down. I was also kind of a little bit depressed this weekend. I don't know what that is all about. I don't know if it's hormonal. I don't know if it's because the weather has just been gray and gloomy and hasn't been warming up as fast, and I don't know, I just felt really tired and blah, and I wanted to sleep more, and I couldn't because, like, I'm tired, but I can't get comfortable in the bed. And also, like, I just laid there like a slug on Sunday, and I don't know, I just felt really down, and I couldn't get myself motivated to do the things that I wanted to do, but also I couldn't feel content just sitting there resting. So just, I kind of felt like that on Saturday. Like, this weekend kind of felt like a bust. I feel like I had so many, like, plans to do. Like, I was going to finish up nursery stuff, and actually I'm still waiting on one thing to be delivered. But I found this cute idea to make a little mobile, however you would say that, and I still have plans to do that, and I went out and bought all the stuff on Friday, and I planned to do it this weekend, but I just wasn't motivated to do anything. But, you know, whatever. We all have our days, so I'm not reading too much into it. However, Sunday night, I went to bed. I actually was surprised how easy it was for me to fall asleep and go to bed, because usually it takes me a while to get comfortable. Well, I woke up at about 2:45 through 2:30-ish with that hip pain that I had a couple of weeks ago. It was so strong. Like, previously I had it only in my one hip, and I think that was at 30 weeks or 29 weeks that I had that pain. But what it is, well, I don't know what it is, but what the feeling is I feel like, seriously, somebody has taken a drill or a screwdriver and is drilling into my hips, and the pain, like, is radiating down from my hips into my thighs and my back, And I know that kind of sounds like that could be, you know, labor or contractions, but I knew that's not what this was. I just knew that because I had this previously in one of my hips, and also it was consistent. It wasn't going away. It was ongoing. Like, I was in my bed, I got out of my bed, tried to walk it out, walk around. I all of a sudden started feeling really sick and nauseated, and I had to go to the bathroom. I couldn't even finish going to the bathroom because I couldn't sit still long enough. Like, I just had to get up. I felt so sick. I was shivering. I felt like I was gonna throw up. I couldn't focus on anything but that pain, and I was trying to like lay down with a heating pad. That didn't work. I couldn't sit still. I was trying to walk around. I was like hunched over on the bed, and that didn't work either. And then finally, after probably about a half hour, 45 minutes of that pain, which was seriously like the worst pain, is this hip pain that I've ever had previously as well. I mean, it was kind of on the same level, but on both sides. So I finally decided to call labor and delivery. I just couldn't stand it. I knew I wasn't in labor. I knew that, but I couldn't figure out what the hell is causing this. So I called them. The first questions they ask, are you bleeding? Did your water break? Are you having contractions? And I told them no, but I told them that this pain is so unbearable and it just will not stop. Last time it stopped within like 25 minutes, maybe 30 minutes. And I seriously could not take it anymore. And then they asked me if I could feel the baby, and I said I don't really know at this point because I just woke up with this pain and I cannot focus on anything. Like, I tried to lay down to see if I could feel the baby moving, but I could not tell because I just couldn't focus on anything but the pain. So they're like, well, come down, and if you feel like it's gonna stop, or you feel like it stops, then just call us back, and if you feel the baby move, then just, you can call us back and stay home. So I tried to wait it out another like 15 minutes, but I just couldn't. It was just unbearable. So I woke up my husband, and I just told him I was going down there. I wasn't even going to have him drive me down there because I felt so bad. At this point, it was like 3 something in the morning, and I felt so bad that he had to wake up and had to get up anyways at 6 o'clock, and I did as well, have to wake up for work. But I just felt really bad because I knew I wasn't in labor. I knew that. So I told him, like, let's go. And so he's like, let's go. And I told him, I gotta go now. And I even like went out the door before him because I just couldn't stand to sit in here. I had to do something. So we got outside, we drove there, and we were literally pulling into the parking lot, and it stopped. And I knew that was going to happen. I just knew that was going to happen. I mean, thank God. I'm just very grateful that it stopped and it did not continue to go on, because it is horrible, that pain. I mean, seriously, it feels like somebody's screwing or drilling screws into. It's horrible. But I'm just like, stop. Stop where you are. I'm not going into labor and delivery because I know they're going to have me hooked up to the monitor for probably about an hour and a half, 2 hours. I don't know how long it's going to take. Depends on how busy they are. And then they're going to see that everything is fine, and we're going to go home. So I also did feel the baby move on the way there as well. So I knew that he was fine. All right, I knew that he probably was fine. It wasn't under really distress. So I did feel like some slight movement. So I called them back and I said, it's going away and we're going to go home. And she said, okay, if it comes back, come back down here. And you want to probably mention this to your doctor when you go in for your next appointment. And she asked me what it was. I told her it's this coming week. And she said, well, if it comes back, definitely come down. So we went home. It was still a little like sore, but nowhere near the pain that I was previously having. So I went back to bed. I had the heating pad on my hips and woke up, went to work this morning. So I don't know. I don't know what's causing this. If you've had this, please let me know, because I'm a little concerned about why this is happening, but I also know that like your body just does lots of weird things when you're pregnant. It's a lot of extra pressure. It's a lot of like morphing. Like your body's literally morphing to like keep this baby in you. And he's big. This is the end. I mean, I guess that can just happen, and the nurse did say that it could be like him pressing on nerves, but man, whew, I don't know what kind of nerves are in there. Holy crap, that was horrible. Yeah, if you have any experience with that, please let me know. I just would really like to know, like, what the heck it is. I am going to ask my doctor about it. I didn't decide not to call because I knew that she probably would say, well, go to labor and delivery anyways now until your appointment, you know, or not until, but, you know, before your appointment. Or I'm sorry, maybe this is bad. Maybe I should be doing that stuff, but I don't have that instinct that there's really anything they can do about it, and kind of what I've tried to find online. I mean, it could be, what was that called? Like, something pelvic displacement something or other. I can't remember the name. And it could be that. It could just be the nerves. I mean, I've been feeling him move, so I'm not really concerned. So, Thursday, well, obviously, if it comes back, if it does it again, I'm for sure going, because I cannot tolerate every day of this pain. I cannot, and I hope to God it doesn't come back. So if it does, I'll obviously go down, and then I will mention it on my Thursday appointment, just to make sure that everything is fine, and, you know, see what she has to say about it. Because I just never know. She's either going to, like, completely write it off, or it's just like, oh, it's just one of those things, or she's going to send me to labor and delivery. Who knows? But we'll find out on Thursday, unless, hope to God, it does not happen again. Please, God. That's horrible. Anyway, I think that's pretty much it for 36 weeks. That's quite enough. This is 21 minutes or 20-some minutes long, and I haven't even shown you baby buys or anything like that, and not that I really have any this week. But I do plan on doing kind of what's in my hospital bag type of video. There's a million of these on YouTube, I know, but I just kind of want to do my take on it, and I'm trying to pack as minimalistic as I can. Well, anyways, I'm not going to talk about that. I'll go into it when I actually have the video, or when I actually do the video. And then also, once I get the last final decorations up here, hopefully within the next 2 weeks, I want to say, well, it better be 2 weeks, because I got 3 weeks left, I should be having a little co-sharing bedroom / nursery tour, and just kind of how we organize that. So yeah, that's it. I better quit rambling and just show my belly really quick, and then we'll be done. So there it is in all of its big glory. Definitely feels, better move back, feels like it's really sticking out there. Yep. So yeah, that's it for 36 weeks, and I should be hopefully uploading a What's in My Hospital bag this week at some point, and then for sure we'll see you for 37 weeks, if not before then, for a nursery little tour. So thank you for watching. Bye-bye.